Hello, this is Dr. Duresti with the Cranial Release Technique. It's the Sunday after Thanksgiving 2022, and I hope that everyone out there had a pleasant Thanksgiving with friends and family here in the United States. We celebrate Thanksgiving. I received a few more comments and questions, and I think it went pretty smooth last week, so why don't we try another few questions and see where this takes us. So, the first question I have here is from a chiropractor in Oregon. It says, can cranial release technique help patients with migraines? Well, most chiropractors would probably tell you that chiropractic in general does fairly well with migraine type patients. But again, from a cranial release standpoint, the simple answer would be I would certainly advise someone with migraines to receive the cranial release technique and give it a try. And here's why. So I have some props with me today. So here's the plastic skull broken into the 22 separate bones that make up the cranium. And again, it was Dr. Sutherland over 100 years ago, an American osteopath, that first asked the question, why 22 cranial bones? Why not one solid bone? And through experimentation, he realized that the reason why nature created the 22 cranial bones was because they needed to move. And this is a Hoberman sphere showing movement. And it's a great example that I used to use with patients to explain how the cranium itself should be breathing, completely separate from pulmonary breathing. This is cranial breathing. So if these cranial bones shift and twist and rock, that movement is impaired negatively. And of course, inside is the brain and the spinal cord, the central nervous system, which controls and coordinates all functions of the body. So if the cranium is distorted and the primary respiratory mechanism is altered, virtually anything can go haywire in the body, whether it's a migraine or a back trouble or a knee problem or whatever. To me, the cranium really is the key to unlocking function throughout the body. So to the question about the migraines, I would certainly say absolutely give it a try. You got nothing to lose. Again, the cranial release technique is very gentle. It takes about a minute to perform. It's the practitioner's hands on the patient's head. Typically, the patient is laying on their back for about a minute on a table. And it's a very gentle move, and it's a very pleasant experience, but the results are profound. So I would certainly say to that chiropractor, give it a shot. The next question is, would athletes benefit from the cranial release technique? This comes from a physical therapist in Dallas, Texas. Again, going back to the primary respiratory mechanism, if this is altered, if these cranial bones have shifted, twisted, and that primary respiratory mechanism is reduced, then anything can go wrong throughout the body. There will be malfunction throughout the body. Again, as I mentioned before, whether that's a knee trouble, whether that's an ankle issue, whether it's back pain, whether it's a shoulder, whether it's an elbow, the musculoskeletal system is tied into this cranial system. So any disturbance at the cranial level will lead to an imbalance throughout the body. And that may not show up until you're 30, 40, 50, 60, 80, 90 years old. So certainly, again, practitioners are found on the website at cranialrelease.com. You can all look there and find a practitioner and visit a practitioner and give the cranial release technique a try. The last one comes from an acupuncturist in Alaska. My child suffers with learning disabilities. What about cranial release technique with learning trouble? And heaven knows there's so many learning issues now with children. Again, here's a miniature model, a plastic skull. And again, this takes us back to the beginning of life for most of us, the birth process. So As we pass through mom's birth canal, the cranium is getting compressed. That's normal, that's natural. That compression then leads to a decompression, and that's what we in the world of cranial and cranial release technique call the blowout phenomenon. The cranial bones opening, expanding, which is sort of kick-starting this primary respiratory mechanism. So when you talk about traumatic birth, when you talk about just what we would call a normal birth, if that doesn't happen fully, if that cranium doesn't come through the birth canal, through the compression, and then the expansion phase, which then blows this open, which is normal and natural and kickstarts the cranial mechanism, then yes, that child could suffer with things like learning issues, coordination issues, skin issues. Anything, again, is secondary to the primary respiratory mechanism. And the only goal of the cranial release technique is to do really one thing. That's to optimize cranial function and restore the primary respiratory mechanism back to its optimum. Again, the earlier a patient would come in to see a cranial release practitioner, the better. The younger, the better. So keep that in mind for everyone out there with children. Optimize the cranium, optimize function, optimize your life. Again, cranial release technique is the name of the company, the website cranialrelease.com. There's also a button there for practitioners if you'd like to learn more about the cranial release technique. How you can learn this technique in the comfort of your home or office, you can click on that button that says Online Training Program. Again, this is Dr. Duresti with the cranial release technique, the website cranialrelease.com. Thanks so much. Have a great day, and I hope to see you soon. Thank you. Goodbye.